This is a video on how to assess a fracture in the fibia. To begin, I'm going to use the squeeze method in order to assess for a fracture. With the squeeze method, you're going to squeeze the bone or bones together. A positive test is going to be pain away from where you are squeezing. To begin, you want to start away from the suspected side of the injury. You may cup your hands together. You don't have to. You can cup your hands around the tibia and fibia, and you're going to squeeze and release, gradually increasing the pressure and squeezing the tibia and the fibia together. So squeeze and release, and moving closer to the suspected site of the fracture. Squeeze and release with the palms of your hands, squeezing those bones together. So beginning again, starting away from the site, squeezing, applying the pressure gradually, and being careful not to directly apply pressure over the suspected site of the fracture when you get closer, because that can give you a false positive. So maybe adjusting the way you're applying the pressure. But again, you're gonna start away from the site, cupping your hands, or you don't have to. And then you're going to, using the palms of your hands, you're gonna squeeze those bones together, gradually moving closer to the site of the injury. And you wanna make sure when you get to the site of the injury to not directly apply pressure. And then again, a positive would be pain away from where you are squeezing at that point in time. Once we have assessed the lower extremity for a fracture in the fibia, we are going to apply our rigid splints to our extremity. You want to make sure that you have the appropriate size and also quantity. You will need one for each side of the extremity or the lower leg. And also you need the appropriate size, because you have to splint the joint below and above the extremity. So making sure we have the knee and the ankle splinted. So in this case, you would have the soft side of the rigid splint on the skin on both sides. So soft side on the skin, soft side on the skin. Once you've done that, you want to splint the joint above and below again, and then we're going to secure the splint to the extremity. And with that, you can use bandages or tape, combination of both. We will have to use wraps or bandages for the rigid splints. And you want to just wrap, and secure the joint above. So in this case, this would be our knee. So we're making sure that we, not directly on the knee, but above. And we are going to secure and splint above the extremity. We're also going to repeat this again above the fractured site. And then also one more below the fracture site. Once we have completed securing and splinting the extremity, we want to assess the ability to our splint to immobilize the joints. So making sure that there's no room and that it stays immobilized. We want to also assess for the athlete's comfort level. We also want to assess for the safety of the splint or the mobility of the splint. And then we also want to assess the capillary refill of the distal extremity. So that would be the toes. So pushing down on the toenail bed, capillary refill is, normal capillary refill is usually less than 2 seconds. And then also the neurological integrity of the distal extremity. So could the athlete feel the sensory touches associated with the foot? And that is how we would splint and assess for a fibia fracture.